Pregnancy is a special time for the mother, and more so for the community that is expecting a baby. However, some conditions like preeclampsia can make the pregnancy experience quite difficult. So today on set on Wanja's Health Diary, we have Dr. Nelly Bosire, who will take us through what preeclampsia is and help us pick the conditions and the triggers, and also the treatment and management. Karibu sana daktari.
Thank you, sir.
Preeclampsia is a common term that in the last 2-3 years has become quite conversational in Kenya. Why now?
Well, that's probably very good news.
Yeah.
It shouldn't have been a new thing. It's a conversation we should have been having over and over and over to create awareness about this condition. If you look, on our list of killers when we talk about maternal health, preeclampsia comes second. Mm-hmm. That is definitely something worth talking about if we are going to try and turn around the statistics when we're discussing maternal mortality.
Yeah, and what is preeclampsia?
It's a condition that is unique to pregnancy. Okay, the chief indicator we talk about is blood pressure, but what people don't understand is that in preeclampsia, the blood pressure we talk about is unique to pregnancy, is induced by pregnancy. Okay, and once you're non-pregnant, it's a condition that should otherwise resolve. So it's characterized by high blood pressure and the leakage of protein in the urine. Normally, your urine should not have any protein. But when we start to see protein leaking through the urine, and will be accompanied by swelling of the hands, of the feet, of the face sometimes, though that's not always have to be there, then we are talking about preeclampsia.
There's a common misconception that a certain degree of swelling is acceptable in pregnancy. What would you say about that? When is it time to see the doctor?
Well, as I said, some patients with preeclampsia could actually have swelling. And, one of the things we usually look at moms when they come to the clinic is to see if they're developing swelling, which we expect most moms to have as pregnancy goes along, especially towards term. It doesn't happen in everybody, but we always say that for the high-risk moms, when they see swelling that is usually quite sudden in onset, and normally for the normal swelling, it would probably be worse at the end of the day after sitting around for long or being standing for long. So by the end of the day, the feet are kind of swollen. So going to bed and lying down and keeping up your feet should make it better. But you'll realize that with preeclampsia, that doesn't happen like that, and the swelling will come irrespective of the position. But usually the key important thing is that the suddenness of the onset of this swelling would definitely should be a trigger that, okay, this is really not normal.
Yeah.
And they would swell all the way to their hands. The fingers get a bit stiff, and they would also swell. The face would get a bit puffy. So those are important things. It could happen to somebody who doesn't have preeclampsia,
yeah,
but more often than not, it will accompany preeclampsia.
So you have gotten a diagnosis of preeclampsia. What next?
The whole idea about preeclampsia is that once preeclampsia sets in, the ultimate treatment is delivery of the baby. So what matters then is how severe is it, and then balancing the condition vis-a-vis the baby. Because preeclampsia, ideally for a patient to categorically be said to have preeclampsia, this rise in blood pressure should occur after 20 weeks of pregnancy. So the earlier it happens, then obviously we're more alert to or more awake to the fact that this baby might not make it to maturity. Understand? Mm. So the whole concept about treatment then is looking at what are we dealing with. Is it a sudden onset high blood pressure, heavy protein leakage, which is telling us that if we do not intervene, we're going to fall into complications, and therefore at that time it doesn't matter the status of the baby, we need to deliver. Mm-hmm. Otherwise, if it is not too bad, sometimes we can medicate the patient, sometimes we may even treat them at home, sometimes we're forced to admit them, monitor them in the wards, give medication, monitor the blood pressure, see how it goes as we buy time for baby to mature. Yeah. Okay, but when push comes to shove and mommy's life is in danger, mommy's life will always take precedence over the baby.
In the event that the baby is born to a mother who had preeclampsia, are there complications that are transferable to the baby?
Well, it's not necessarily complications of preeclampsia preeclampsia transferable to the baby.
Yeah.
It is what the condition does to the baby in the womb.
Okay.
So obviously, what happens in preeclampsia is that there's always an inherent problem at the level of the placenta. Remember, this is where baby feeds from. So we know that in preeclampsia, there's usually some abnormality in the development of the interface between blood from mommy and blood from baby meeting, which means that the baby's acquisition of oxygen and nutrients, which have to come from mom, are compromised. So when it is so severe, it is obvious because the baby's growth will be slowed down, their weight gain will not be doing well, the baby's activity is also compromised. So this is when we tell the moms, watch out for the baby's movements, because if baby's movements reduce, then we're not in a good place. So that obviously will impact on the baby. The other thing is that when you get severe preeclampsia early on, before baby has matured, obviously we're exposing the baby to prematurity. If it's below an age where we are able to sustain the baby in our facilities in terms of the newborn care or neonatal ICU care, then we are looking at essentially saying this is a miscarriage. If it happens below 28, 26 weeks, and we know the baby cannot survive, we have had to sacrifice the baby to keep mommy alive.
Yeah.
But once they cross 28 weeks, now this is the doctor's battle. You don't want them to be too small because the risk, of them, what they go through to survive are very high. At the same time, as you're trying to buy time for them to get a little older, we're also having to look at mom, where is she sitting? And if her functions are deteriorating, her organs are shutting down, her liver is going down, her kidneys are going down, we're not going to wait. Okay, so baby has to come out. But sometimes preeclampsia can hit you like a ton of bricks out of nowhere happening, and you find you're at term and baby is coming. We're happy to quickly deliver the baby, and we expect to have good outcomes for both mother and baby.
Yeah.
So on the side of the baby, the risk is always the impact on this poor circulation to the baby in development, and of course the risk of prematurity that will probably follow in due course.
Okay.